Imagine this, a condition that affects millions of young women, yet remains shrouded in mystery and misconception. Welcome to the world of Polycystic Ovary Syndrome, or PCOS. But here's where it gets controversial. Is PCOS something you inherit, or is it a result of your lifestyle choices? Let's dive in and explore the fascinating and sometimes confusing world of PCOS. PCOS is a complex hormonal disorder that affects countless young women, particularly in India. Managing it effectively involves a combination of lifestyle changes and medical care. But what exactly is PCOS, and how does it differ from PCOD? And this is the part most people miss. The distinction between the two can significantly impact how you approach treatment and management. PCOS is a hormonal disorder where the ovaries produce higher than normal levels of androgens, often referred to as male hormones. This hormonal imbalance can lead to a variety of symptoms, including irregular periods, infertility, weight gain, acne, and excessive hair growth. Think of it as a domino effect. One hormonal change sets off a chain reaction that affects multiple aspects of a woman's health. Now let's talk about PCOD, or polycystic ovary disease. While it sounds similar, PCOD is slightly different. In PCOD, the ovaries release many immature or partially mature eggs, leading to the formation of cysts. Unlike PCOS, PCOD is generally less severe and more manageable, often limited to issues within the ovaries themselves. But here's a thought-provoking question. Why do so many people confuse the two, and does it matter? The answer could change how you approach your health. So, is PCOS genetic or lifestyle related? Dr. Nidhi Sharma Chauhan, an obstetrician and gynecologist at Safi Hospital in Mumbai, sheds some light on this complex issue. It's not a simple either-or scenario, she explains. Both genetics and lifestyle play significant roles in the development of PCOS. Research indicates that PCOS is more likely to develop when a growing baby is exposed to high levels of androgens or environmental pollutants during pregnancy. This exposure can set the stage for hormonal imbalances later in life. Additionally, PCOS can run in families, with certain groups, like Asians, showing a higher predisposition. But here's the kicker. Not everyone with a genetic link will develop PCOS. So what gives? Lifestyle factors are crucial triggers. Weight gain, chronic stress, poor sleep, physical inactivity, and unhealthy eating patterns can all activate the condition. Think of it like a ticking time bomb. The right or wrong combination of factors can set it off. PCOS is not a one-size-fits-all disorder. Some women struggle with irregular periods and infertility, while others face metabolic complications like insulin resistance and weight gain. And some, unfortunately, experience the full spectrum of symptoms. This diversity makes diagnosis tricky and requires an individualized treatment plan. Unlike conditions with a clear set of symptoms, PCOS affects women in very different ways, which is why awareness is essential. The good news? PCOS is treatable. Although PCOS is not necessarily a disease that needs lifelong treatment, it can be managed effectively, Dr. Chauhan reassures. With the right lifestyle modifications, medical guidance, and preventive care, patients can maintain healthy metabolic parameters and live a normal life. Managing weight, eating a balanced diet, getting regular exercise, reducing stress, and improving sleep hygiene can all make a real difference. Medicines may be prescribed depending on symptoms, but lifestyle remains the foundation of treatment. So what do you think? Is PCOS more about genetics or lifestyle? Or is it a bit of both? Share your thoughts in the comments below, and let's spark a conversation about this often misunderstood condition. Your insights could help someone else navigate the complexities of PCOS.